that is our primary IV spike and prime. We also have secondary bags. These usually contain our IV antibiotics. We may be administering magnesium, potassium. There will be some form of admixture in our secondaries. There are two things that occur with a secondary. Sometimes your patient has been in the hospital for several days, so you're using the same set that's already up there. I'll demonstrate that too, but we're going to do a primary set first. There are several things that come in the bag. We will be discarding the little loops, the miscellaneous. All we need from our bag is our short secondary tubing. Same principle applies. We are replacing the air in this line of tubing with our fluids. Once again, we have a tip that is covered and our IV fluid bag. We want to open the cap. Some open with a snap, some have a little plastic covering. Whichever method, pull off the cap, replace, open, make sure this does not touch anything, and then insert into your tubing with a twisting motion. Make sure you do not twist your bag to the side. You will puncture your bag and everything will go all over the place. Prior to, remember we had closed our line so that the fluid wouldn't run through. This particular one has a roller clamp. Simply roll it down toward the end of your line, and that closes your line. Put our bag, and now fill my chamber to the little line, and then I'm going to release my roller clamp so that my fluid will come through. I'm going to release it very slowly because it runs fast, and you want to make sure, see this large bubble? We want to get rid of all those large bubbles. I can watch it as it drips, and all my bubbles are gone. I'm going to close it, and now I have it ready to administer to my patient. Spike the bag, prime the line, removing all the air. With this, I know one of the other videos you may have already visualized, we have the needleless system within the hospital. I don't have the needleless system here. This piece right here will attach to this part of your IV pump plumb set that you have in there. With this connection, you will be able to administer this as a secondary unit. Before you actually attach, you will clean your site for 15 seconds with an alcohol prep. And that means really rub that. A simple little wipe, gentle rub does not get rid of the bacteria. And then attach your set here. With our secondary line, we're going to set our pumps. All pumps work on the same principle. That's why I'm going ahead and walking you through this particular one. Here, we want to set it on secondary. Our rate, we want to, let's set it at 100 ml per hour. This is a 100 ml bag. I want it to go in over 1 hour. I'm going to set my rate at 100. The volume to be infused is 100. And that means that in 1 hour, this bag, my secondary bag, will be infusing for my patient. And run. Once the secondary bag has finished, it will go back to your primary and you will have that fluid that's infusing. This, with the secondary unit, it can stay attached until you're ready to hang the next unit, or if you have another medicine to administer, it can stay until you're ready for the next administration. And with these, note that these tubes are good for 72 hours. The hospital will have a connector, a little piece of paper that's put on here that says your IV tubing should be changed, and it tells you which day to change it. If this occurs on Tuesday or Wednesday when you're in the hospital, it is your responsibility to spike and prime and change the IV tubing on either your primary set or your secondary set as you go throughout your day. A couple of other situations that I did want to bring to you right now. Sometimes the medication that we have is administered in a bottle. This particular one is an electrolyte solution. The principle is still the same. You've got your plumb set. Make sure it's off. And then I'm going to make sure I have this is clean. Now notice I attached this, put it back on. That is so it would remain sterile, because I need to remove the top on my bottle. They're covered with a metal piece. Be careful you do not cut yourself with those. And then the top has a plastic lining. The bottle has an opening. You see one has a vent, and then the other is a hole that we're going to be placing our spike into. Removing the cap with a gentle twisting motion, we're going to push in until we have spiked the bottle. Once again, we're going to hang. Fill our chamber, and on your sets, there's a valve right here that allows air to come into the bottle so our fluid can come out. Holding this upside down, and you'll note they do get twisted. So we'll untwist. The cap is on the bottom. Sterility has been maintained. Get it untwisted. If you could smell, this stinks. Opening the bottom, the little cap here, we're going to open. The fluid will come in. When it reaches the top, we're going to flip. When it reaches the top again and is coming through, we're going to allow it to run out until we've replaced all of the air in our line with fluid. You can see bubbles. You may not be able to see, but there's bubbles coming up through here. And once it has reached the end, turn off your little white cap here, replace the end, and this now is ready to be attached and administered to your patient. It would go in, your plumb set would go into your IV pump. Everything else remains the same. The only difference is on a bottle, we need to open our air vent. That concludes the session on Spike and Prime.